Welcome, everyone. My name is Jennifer Jentzsch, and I'm a community health worker, care wellness specialist, personal health navigator, end-of-life doula, PPR trainer, and mental health first aid trainer here at Good Shepherd. And today I'm going to be talking to you about suicide prevention. I have some friendly reminders before we get started. It's okay to step away, so at any time you need to leave, that's totally fine. If you could just give me like a thumbs up or some type of signal so I know that you're okay. Otherwise, I might have Brody follow you out. So let me know, make sure you're okay. And number 2, take care of yourself in your own way. So if you need to be on your phone, if you need to be fidgeting, if you need to be doing any of the things, I will not be offended. I understand. And then number 3, you are not alone. Support is available. So I will be the last to leave just in case anyone needs to talk or would like more information. I will be here.
So the person who was dealing with the other guy, she liked to keep things to herself.
Oh, okay.
So
That's okay. We can. Thank you. So what will we discuss? We're going to go over suicide awareness, statistics, words matter, myths and facts, what you can do, and resources. So what is suicide? I don't like to have a lot of wordy slides, but I feel like it's really important to know the difference between suicide, suicide attempts, suicidal ideation, and non-suicidal self-injury. So suicide is defined as death caused by self-directed injuries or behavior that intent to die as a result of that behavior. A suicide attempt is a self-directed, potentially injurious behavior with intent to die as a result of that behavior also. A suicide attempt might not result in death or injury. Then there's suicidal ideation, which refers to thinking about, considering, or planning a suicide. And then non-suicidal self-injury, or NSSI, refers to self-inflicted acts that cause pain or superficial damage, but are not intended to cause death. It is different from an attempted suicide, as it's not ended at aiming one's life. And then we're going to go over some myths or facts. So if you just want to raise your hand if you think that it is true, and keep your hand down if you think it is false. So the first one is, talking about suicide does not increase the chance a person will act on it. Is that true or false? Okay, so that's true. Talking about suicide may reduce rather than increase suicidal ideation. It improves mental health related outcomes and the likelihood that a person will seek treatment. So I urge you to start conversations if you feel necessary. Our next one, people who talk about suicide are just seeking attention. Is that true or a myth? Okay. Yes. That's a myth. Talking about suicide is a serious warning sign, not a ploy for attention. Many people who die by suicide have previously spoken about it directly or indirectly. Also, seeking attention is not inherently negative. If someone is expressing suicidal thoughts, they should get attention. Next, we have suicide can be prevented. True or false? True or false? Perfect. So it is true. Suicide is preventable, but unpredictable. Most people who contemplate suicide often experience intense emotional pain, hopelessness, and have a negative view of their life or future. Next, suicide only affects individuals with mental health conditions. Is that true or false? Correct. Many individuals with mental illness are not affected by suicidal thoughts, and not all people who attempt or die by suicide have a mental illness. We have a couple more here. People who die by suicide are selfish and take the easy way out. Is that true or false? Thank you. Typically, people do not die by suicide because they don't want to live. People die by suicide because they want to end their suffering. These individuals are suffering so deeply that they feel helpless and hopeless. Next, most suicide happens suddenly with warning. So it's a little tricky. Most suicides happen suddenly with warning. So that one is true. So Warning signs verbally or behaviorally precede most suicides, and that's why the word most is in there. Sometimes it doesn't, but most statistics show that mostly it does. So therefore, it's important. That's why we need to know the signs. Right? Okay. Next. Once an individual is suicidal, he or she will always remain suicidal. True or false? False. Active suicidal ideation is often short-term and situation-specific. The act of suicide is often an attempt to control deep, painful emotions and the thoughts an individual is experiencing. Next, actions that reduce access to lethal methods of suicide don't work. Is that true or false? It is a myth. So, limiting access to lethal means of harm, such as firearms, is one of the most straightforward strategies to decrease the chance of a suicide. Many suicide attempts are a result of an impulsive decision. So separating someone from a lethal means could provide a person with some time to think about it before acting. Good job, everyone. Next, we're going to go into some methods of suicide. You can kind of see on the left, so we have female and male. The bottom is firearms, and then suffocation, poisoning, and other. And firearms are the most common method used in suicides. They are used in more than 50% of all suicides in 2023. And then again, you can see the difference by genders here. And then we go into suicide rate disparities. Find the other one, please. Okay. On the left, you can see that the racial ethnic group with the highest rates in 2023 were non-Hispanic, American Indian, and Alaskan Native people, followed by non-Hispanic white. And then on the right-hand side, you can see that people ages 85 and older have the highest rate of suicide in 2023, and this is per 1,000 people on each of those. The suicide rates among males also in 2023 was approximately 4 times higher than the rate among females. Males make up about 50% of the population, but nearly 80% of suicides. We go into some more specific statistics, Oregon-wide. So Oregon, and the way they do this is kind of strange. You can do the other one too. The way they do this is kind of strange because you can see Oregon ranked 42nd. And you go, oh, okay, that's good. It's not. We have, so the state prevalence of adults with serious thoughts of suicide range. So we are 42nd in America. And then the state prevalence of youth with serious thoughts of suicide ranges, we rank last. We are the worst at 51%. Okay, so what can we do with all this information? First, we can take all clues and signs seriously. The more clues and signs observed, the greater the risk. We can listen non-judgmentally, so listening without prejudice or judgment, and separating our own feelings from the speaker's words. We can actively understand the other person's perspective and resisting the urge to offer advice. And then we can connect to resources while remembering that people that live with suicidal thoughts often believe they cannot be helped. So you might have to do a bit more than you usually would. We can also ask. So, and if you can't ask the question, are you thinking about suicide? Are you suicidal? Please find someone who is able to ask that question. We have a less direct approach and then a direct approach. So the less direct approach might be, have you been feeling down or not quite yourself recently? Have those low feelings been pretty intense or hard to shake? Or you can have the more direct approach. I'm concerned about you and I want to ask, have you been having thoughts about ending your life? Or are you having thoughts of hurting yourself or ending your life, right? But what we don't want to do are ask questions. You're not thinking of killing yourself, are you? Like those directed questions. You wouldn't do anything stupid, would you? Questions like that add that stigma and also kind of direct them towards the answer you're wanting to hear. And then while we are asking or having these open-ended conversations with others, we want to make sure that we're being mindful of our words. The word committed is historically linked to crimes or morally wrong acts. Examples would be committing murder or committing a crime. Using more neutral language reduces stigma. So saying died by suicide treats it as a cause of death, similar to died by cancer or died in an accident. And calling a death by suicide successful unintentionally suggest that a person accomplish something. Surviving a suicide attempt is not a failure. It's an opportunity for recover, healing, and help. So describing it as unsuccessful is not only insensitive, but also adds shame and guilt. And then saying someone lost their life to suicide removes blame and treats the death as a result of a mental health crisis, not a crime or character flaw. And then here we have our resource page. So you can call or text 988. That is available 24/7. It's a wonderful first line resource, right? And they are non-judgmental. They're gonna get you the crisis workers that you need in person. You can also look at all of the statistics and everything I shared today at Oregon Suicide Prevention. And then we also have NAMI and SAMHSA, which are nonprofit organizations. And then this is my information, so you can get in touch with us at the Connections Department where I am located. And if you're needing any more information or to further expand on any of these things or want to know about our QPR training or our mental health first aid training, you can always reach out to me.